understanding also the stuff. So I worked with a lot of people, some very high skilled. So you understand who's where and who can do what, which is kind of one critical thing. Just by knowing someone who can actually do something, you're on a better way than not knowing. Well, it's more about the mission. As I mentioned, we really wanted to create an impact and use technology to help people and to support. What we believe is that you can have a business that creates a social impact and kind of works for good in a way, right? Now, the problems start from the beginning, right? So when we said, okay, let's do a mock-up and show that we can have a platform that can have, I don't know, pharmacies, hospitals, everything listed, so people can start from the beginning and know that a certain pharmacy or hospital exists. We are not kind of just getting a solution from India or from anywhere in the world and kind of placing it here. We are actually designing the products based on our market and what kind of needs to be done. We have that ability, which is great, and which is also hard because we sometimes we don't want to develop everything, right? If it's simple, then we are not going to reinvent the wheel.
Welcome once again to Africa Tech Talks. Our guest today is Pedro Beirão. Pedro is the co-founder and CEO of Appy People, a pioneering Angolan startup that has made significant strides in the fields of health, education, and payments. Born and raised in Angola, Pedro has over 13 years of extensive experience in the technology and telecommunications sector. His primary goal is to develop sustainable solutions that have a high social impact, particularly in regions where access to essential services is limited. Under Pedro's leadership, Appy People launched its flagship product, Appy Saúde, in 2017, and Appy Saúde is the largest digital health platform in Angola, providing users with real-time information on the availability and prices of medicine across pharmacies. This platform has revolutionized access to healthcare information in a country where such data was previously hard to come by. The app allows users to compare prices, find nearby pharmacies, and even purchase medicine online for home delivery. Pedro's vision extends beyond healthcare. Appy People has also developed Kassai, an e-learning platform for health professionals, and Appy Pay, a digital payment gateway that simplifies transactions for merchants and consumers alike. These initiatives are part of Pedro's broader mission to leverage technology to simplify lives and promote smarter living in Angola. Pedro's innovative approach and commitment to social impact have positioned himself as a key figure in Angola's tech ecosystem. His work continues to inspire and drive change, making essential services more accessible and efficient for millions of people. Join us today with Pedro Beirão. Pedro, welcome to Africa Tech Talks. It's a huge pleasure to have you with us.
Thank you, Andre.
Welcome, Pedro.
Thank you.
Welcome, Pedro. Yeah.
Without further delay, and we all want to know what has created Pedro as the figure he is today. So, can you tell us a little bit more about your journey and what inspired you to get here as a co-founder of Appy People?
Sure. So basically, I've always been in the tech realm, let's say. So I have an engineering degree
background,
and I started working in mobile operators, so the Net1. I was also part of a Total in terms of telecommunication projects. I worked in Huawei as a sales solution sales manager, where I kind of worked with a lot of mobile operators and being a lot, pretty much involved in the ICT sector in Angola. However, I really wanted to work in something or in tech-related company that creates an impact and works with information. I think that part is not kind of said often, but the fact of working with different types of information and being able to organize it, we really believe that this creates a wider access and a fair society, right? So where people can actually make thoughtful decisions based on the data that they have. And having access to data here in Angola has always been kind of a challenge. Either the price of medicines or knowing which documents are needed for the ID card, which has improved over the years.
Over
But I
the years,
remember,
yes,
like,
definitely.
I remember 10 years ago, you go to different agencies from the government asking which type of document you need for the ID or the passport. They would give you different information. So it was clear that we kind of needed to organize the information, and digital seems to be the solution. So that's kind of what kind of drove us to really start looking and building something that creates a social impact, being driven by tech solutions.
So as far as I understand, you've been trying to level up the field so everyone can have access to the same kind of information as gathering the information. And that came from your background in tech. So you understood that you needed to do something more impactful than just work for some more established brand or some more established company. And you decided to go on your own and take the entrepreneur way. It takes courage.
Yeah, and which was not something it wasn't something that I was dreaming of and saying, oh, one day I need to open my own company. It wasn't something that I kind of had. But every time I was actually thinking, is what I'm doing really makes sense if I look back 30 years from now? And I really wanted to, while we have energy, right, to work on things that create an impact and that can make us proud in the next 30 years.
I remember listening to this speech from Steve Jobs at, I think it's Princeton, which he says, connect the dots. You can't connect the dots before passing through them. And this leads me to this question, which is, what dots did you connect it between your professional experience, your background as an academic? What dots did you connect it so that today you're in this position?
Well, everything that you do kind of creates a bridge and helps if you're really thinking about the process and really analyzing what you have. So you start putting the dots together. So I think working in the ICT sector gave us, or me at this point, perspective of what is the tech stack and what's the tech environment here in Angola. Understanding also the staff. So I worked with a lot of people, some very high skilled. So you understand who's where and who can do what, which is kind of one critical thing. Just by knowing someone who can actually do something, you're on a better way than not knowing. So, and that I think also experience, right? Because 10 years ago, the ICT sector in Angola was growing very fast. We had one of the countries with the largest fiber optics. We were actually preparing 4G, one of the first countries in Africa at the time. UNITA was investing a lot on new technology, etc. Other mobile operators as well. I worked in Huawei, so I was actually seeing what was going on. So that gave momentum as well. Like, this is happening. Operators are going, technology is growing, and the fact of having a better ICT environment creates which is the next step for mobile operators as well, right? So you have everything connected, fibers, etc. Then the conversation starts to be the OTTs, the over the top, right? So which services you can have on top that actually makes sense for people to consume? Because when your internet connection is large and a broadband, you need things that run on top, which is what's happening now. So that also kind of made us think, hey, there's no available content in Angola for people to consume. And the content should actually make sense for people, to start using. So this will grow. So that gives us perspective and kind of some insights of what needed to be done and the timing.
Interesting. Because one of the things that and after we already passed the 25th episode, so we've been interviewing entrepreneurs from Africa, from Angola, other countries. And one of the things that I see is that most people that go into the entrepreneurship, they have experienced mostly either tech or telecom jobs, and most of them are in engineering. Most of them tried big companies before they launched as an entrepreneur. And as you said, you said that, oh, it was not in my plans to be an entrepreneur. So at some point there was some trigger, and probably also, and this is why probably Angola is one of the places where more entrepreneurs are born lately, is that there was this big environment or this critical environment for things to grow. Yeah, interesting. Very
Yeah.
interesting. I pass my word now to Victor. I think he has some questions to do. Victor, please.
Yeah, hello. Thank you, Andre. As you just said, there was a kind of momentum to start up, and you have chosen the healthcare sector. Why was that? Some specific needs in that, some specific things that you discovered in that sector that led to this pioneering and game-changing app at that time.
Yeah, it's more about the mission. As I mentioned, we really wanted to create an impact and use technology to help people and to support. What we believe is that you can have a business that creates a social impact and kind of works for good in a way, right? Especially in environments such as ours, where things are just starting to exist and grow, and there's a lot of things to organize. So in the beginning, we really wanted to tackle healthcare and education, because once again, we think this is kind of the base of our society, and it's often things that are kind of left behind somehow. And this is kind of, in a way, it's investing in tech or investing in people through tech, if you know what I mean. So the healthcare decision was really, the foundation of what we wanted to do from the start. Then we started thinking, how can we use technology to improve healthcare real?
You wanted as a primary mission to take advantage of the information that was not transparent or very asymmetric in the market to make it useful. This Appy Saúde journey, what were the most critical moments that you have faced? Because it's also a closed sector, right? It's not easy to get into that.
No, it's the journey has been, it's really a roller coaster, right? So one thing very important is that when you have a purpose and a mission, it just makes sense, right? And I think that's something, we are driven by the impact that this can have in the long term, and what this can really do to people's lives, right? So that's kind of our drive. And then we kind of, we are always analyzing and trying to connect this. Now, the problems start from the beginning, right? So when we said, okay, let's do a mock-up and show that we can have a platform that can have, I don't know, pharmacies, hospitals, everything listed, so people can start from the beginning and know that a certain pharmacy or hospital exists, right? That's kind of level zero. And we went online and we checked, and there's nothing. Google doesn't have this mapped. And we're like, ish, we'll have to collect that information ourselves. So with this, we had to create a model where we had people kind of going to different hospitals or pharmacies with a form, with a digital form, and collect information kind of live. And we did it with the initial pilot, we did for about 500 pharmacies and hospitals here in Angola, in Luanda. And then we kind of went to the whole, so this allowed us to do a mock-up and to really show that the process works. And then we went to, at a national scale, going everywhere. So that's kind of challenge one. So that's the
Right.
first one. But then you have everything else, right? So we had Sistec on board as an investor, which kind of gave us pace and the ability to go to a national scale. Then there were a lot of things. So we had information there. We need to update information. We need to involve pharmacies. Everyone, one of the challenges in the beginning was to convince pharmacies or hospitals that we are not doing anything with their information. And what we are placing online is public information, right?
Right.
So that kind of took us, I don't know, 3 hours sometime to convince the first pharmacies or the first hospitals to say, no, we are just asking for, your address, if we can take a picture from outside, and, your phone number of the pharmacy or hospital, basic stuff. And the confidence, or, the trust level was very low. and we kind of
Pedro,
had to
allow
create
me
something there. Go ahead.
allow me just to pose you a question, which is, was the National Agency for Data already created, or was it before that?
No, it was before. So we were collecting information on 2014. No, there was nothing. And we
The
actually started.
agency is 2016, right? Something like
Yes,
that.
it was, I think it was about 17 ish. We started by, so we didn't want to reinvent the wheel. So we started by asking if there was information available, so online, and we went to Direção Nacional de Medicamentos at the time, now is ARMED, to check
Right.
what they had, right? Nothing, nothing at least public. So which made us kind of go that way. So that's one challenge. And then along the way, of course, it's kind of the challenges of having a company and the challenges of having information online and the challenges of having real-time information. So everything kind of started piling up and we were solving issues one by one. So, but I think the milestones, if we look that way, it's really having the, collecting information. So having the investors on board, one, which allowed us to have a team as well, collect information at a national scale, launch the initial version, and start then doing the iterations there, right? So it's good to have the information. Now let's add the stock. Now let's add hospitals. Now let's add doctors. So we started kind of going one by one. And again, if you're doing the long run, you'll tackle issues as they come. Some are planned, some are new, changing
Right.
legislation, etc. Yeah. So, but it has been interesting. So we launched in 2019 the pharmacies with the stock information. So not only knowing that the pharmacy exists, but which stock the pharmacy has, and that was kind of a major change because that really brings information that people didn't have at the time.
Right. I can guess that one of the initial barriers was that the transparency on the prices of the products, right? Because there's lots of discrepancies in terms of that, and also lack of information. Yeah. So, and how do you keep that information updated or up to the moment? Because now you are integrating a huge amount of data points, right?
So basically, we are integrated with different pharmacies with their stock management system. One of the challenges that we have is not only the integration and having the products available, is that we don't have a national yet. We don't have a national code for different products. So an aspirin that is imported from Brazil and an aspirin that is imported from India have different codes, which kind of raises a challenge is not only having the access to the products, but also kind of creating a database of products with information that kind of tells us that the aspirin from Brazil and the aspirin from India is still aspirin. And it's connected to a certain product. So we have algorithms running behind, so integration running, but definitely a system that runs behind to identify, this is an aspirin with the same dosage from the other one. This one has this code, this one has the other one. And it's kind of always mapping different codes to specific products. This particularity made us have to develop a solution that is tailored to our market and our needs, and that's pretty much driving what we are doing. We are not kind of just getting a solution from India or from anywhere in the world and kind of placing it here. We are actually designing the products based on our market and what kind of needs to be done. We have that ability, which is great, and which is also hard because we sometimes we don't want to develop everything, right? If it's simple, then we are not going to reinvent the wheel. But in the healthcare environment, there are a lot of things that are particular to our context that we had to develop. So to have the information up to date, yes, we have integration with different pharmacies or hospitals. But then on the other side, we have a system that is kind of recognizing which product is which product and mapping and placing those products online.
Also, you did realize in this journey that you had to move also into the field of education for healthcare professionals. How was that? Was a gap that you have identified, or how came that opportunity
Um,
to your side?
well, So, as I mentioned in the beginning, we really wanted to focus on healthcare and education. We through our path, we actually started having different partnerships with different entities, and one of the entity was PSI, People Services International, which is an NGO which works with an American NGO, which works with the Ministry of Health in Angola, and they are looking for. They're still looking for all type of digital solutions that can kind of help real life, right? Um, One of the things that we had in Appy Saúde is that we are working with pharmacies and hospitals, pretty much in the private sector. We really wanted to go to the public one, and again, if we are talking about the impact, you need to go to where most people are. So that's kind of so we were challenged at the time to think of a solution to provide training to health professionals, and that kind of that rose an opportunity to create a product that actually made sense. So we with PSI we developed this Kassai platform, which is an e-learning platform based on Moodle. Very interesting, focus on health professionals, and really wanting, instead of just having PDFs and PowerPoints, we really wanted to have something that is almost kind of a Netflix for for healthcare education, where you press play, you have a voiceover, you have things going and happening, and people can actually do a pre-test, they do a post-test, they have certifications, so they really started learning, and we really started measuring kind of improvement, and it was amazing to see how having access to healthcare information, important healthcare information through videos could actually help to understand better and faster things, right? So it wasn't that boring traditional training where you just have the books and go. It's really something that is more interactive. So we kind of took the opportunity. We did it with PSI. We developed the platform. We defined the model. We refined the model. Then again, with them, we helped creating the content, and PSI with us, kind of doing the whole thing, but also implementing on field in different provinces in the whole country. It's been an amazing journey. Over 10,000 health professionals today, which is great, between mostly nurses, doctors as well. 10,000, yes. And it's a major tool that the Ministry of Health is using. And so not only we are providing information to people, but we are kind of helping the healthcare sector by improving the quality and the knowledge of health professionals, which is something that we need everywhere, right? Improving people's capacity and being able to work on that. So it's been very, very interesting.
Actually, that is probably one of the biggest concerns for the ministry, and also one of the biggest gaps that people, whoever I talked to, and we had already a initial guest that hasn't came to the podcast yet, but she already identified that education is probably the biggest gap in terms of what the country needs in terms of usage of equipments, practices, everything. That's really important. I'm sorry, Vitor, but this is something that came to my mind from our conversation with the other guest, and it's really incredible what you guys are doing.
Yeah, and again, it's really using technology to invest in people. I think that's one important thing, right? If we are looking for Angola in 30 years from now, or sub-Saharan region as well. So if you are looking to that at that and say, what can we really do if we invest more? We believe in that. If we invest more in people, if we use technology to accelerate that, we'll most probably have better results in 30 years than now just having the technology. Technology itself, yes, kind of helps, but doesn't solve the whole thing, right? It's just a piece of the puzzle. So we need to create technology that involves people, and if we empower people in the long run, then definitely it's a win.
Yeah, that's fundamental. The adoption of the technology. Yeah, that has been really interesting. I am now handing over to Manuel, who will continue this journey with you in terms of innovation.
Pedro, thanks for coming again. And episode is known for his approach of for collecting and disseminating information about the health system. So, can you elaborate on the unique method you used to build your database?
Ish. Yes. uh, I mentioned I gave an example now of how the mapping has to be adapted
Mm,
to what exists, because then if you don't have a national number or if you don't have a national code for the aspirin, how does it work, right? And when you receive
yeah,
the stock from the pharmacy, what should you do?
yeah,
So that's one approach that we kind of took along the way, and it's something that we do it in the background, but just to make sure that the information is kind of reliable. Then there's a lot of other things that that relation is kind of created in the database. So again, in the beginning, we really started to we looked at other databases and said, well, maybe we can use that. But once we got into more details, we realized that yeah, some of the things didn't work. Let me give you kind of a simple example. When we were
mm,
collecting the information, so you have the GPS location, which of course works very well.
mm.
Although a lot of people doesn't know how to read GPS locations, and you see this with drivers looking at maps, etc. So that's
Yeah,
and when some of our technical staff were actually was collecting information, so they collect the point, but they were trying to have an address. You don't have an address everywhere in Angola, right? So
yeah,
we kind of had we added fields for reference, right? Near
yeah,
Banco Sol,
yeah. Yes,
that
no.
kind of stuff that you say, oh, okay, this is not Google-ish, but but it works in our context and people understand how it works. Near the police station, or we had
Yeah,
just sorry, an example that it's not related to your question, but it's
yeah,
interesting.
yeah.
So
No, but it's important. It's important to have it.
when we were collecting information, I think it was Cabinda, so I was there. Kind of, we provided training to different teams, right? So we had a team in Cabinda collecting information on how to collect information on health establishments. And the interviews were interesting because we were like, okay, what time does the pharmacy open at Sundays? And he was like, after church. We're like, okay, but do you have a time? No, when the we have church, when the thing ends, I come and I open the pharmacy. We're like, okay, so normally, what's the
Yeah,
latest time that you open a pharmacy? Never after 2 o'clock. I was like, okay, so that's your schedule. Let's say maybe you'll open before, but you
yeah,
understand. So you have a dynamic that happens around, and you need to build a system in a way that it
yeah,
provides something to people, and it kind of makes sense in your context. So we kind of built the whole database. We kind of built it in a way that it makes sense to the logic that we have here, which is not always the logic that we have everywhere. So it's kind of expanding.
sure.
We did an experience in Rwanda, which is a little bit different. So people don't, the private pharmacies are not that, well, they are strong, but you have, yeah, they have what we call assurance mutuelle, which is the national insurance. I think it's like $3 for everyone, and they pay less on a lot of products. So almost no one buys products just directly from the pharmacy. They always use their insurance coverage, the national one. So it's not something that we have here. So again, we kind of
Yeah,
built the platform in a way that this could be addressed. So again, the advantage of building your own solution tailored to your needs is that you can adapt it, and you can think of this in a holistic way, right? The disadvantage is that it takes more time and more energy, and
yeah.
yeah, that's
I think this example that you share with us about the Kenya, it's quite similar to the Mexico. I think it's farmacias similares.
mm,
In Mexico, they are addressing quite similar solutions regarding to the insurance that allows the people, especially for diabetes and some other diseases,
yeah.
that they have an insurance. But of course, this needs to have an agreement with the government and only donors and so on
No, pharmacies
to support.
similars, they did very interesting, because they focused on generic, then they
Yeah,
had the
exactly.
distributor, and then they kind of placed a small kind of, not really hospital, but a doctor nearby. So they started
Yeah,
providing appointments and having the pharmacy connected. So they built the whole ecosystem that became kind of huge, in a market
yeah,
that had some of the issues that we have here. So it's a I agree with you. It's an interesting case to look at. You also know it.
yeah. Yeah, and we asked about the data because of course we know that it's quite difficult because of the things like transparency and confidence from the people, especially in the traditional markets. How we can consider to them to share the information about the business, and more like critically it's to have information about the stocks. So we know that it's challenging to integrate your needs for information and that information also to support the business. But
Yeah, no,
I'm personally I'm happy for you to like addressing
no,
this kind of issue.
and I can just let me kind of give you some insights of how this was. This was kind of in the beginning, it was very hard. So when we started talking with pharmacies, they were like, "What? Giving you our stock and our price? No way. Everyone will see it." And we were like, "Okay, if someone
Yeah,
comes to the pharmacy anyway, they know, yes, but they need to come, etc." So
yeah,
we actually we said that that information is the information that will kind of bring people as well, because they're thinking it
yeah,
drives people away. But once you understand and you start entering, you understand that this kind of drives more people in rather than
yeah,
push people out.
yeah,
And it's also a great metric for them to understand what's going on, because they are doing the prices by sending people to different pharmacies,
yeah,
pharmacies
yeah,
that are in the same neighborhood. So we had the first pharmacies that kind of jumped in, and it just made sense because their salespeople saw there, then they went there and they were like, "Huh, this is interesting," and the price that we are doing is more or less the same. So then when you have the
yeah,
first early adopters, it just becomes easier because
yeah,
you have that trust barrier
yeah,
that you gain and that you go over. So, but it took some time. But once we got to that, it was a no-brainer, right? And we still have pharmacies today
yeah.
that kind of contact us and say, "Hey, I want to be listed online. Here's my stock." And we're like, "No, no, let's just let us discuss." "No, no, take the stock now. Just go ahead." And that kind of changed.
Yeah, they changed the attitude. Yeah, Pedro. Another question that I have for you is: in what way do you measure the impact of the Appy People products?
Yeah, that's a hard one. So when we
Yeah,
look at the episode, everything that is digital, we look at searches, we look at people using the platform, how many are doing and what they are doing. We
yeah,
measure in Kassai, for example, how many learners, how many courses they have made, and how we are impacting that. So you were asking about the database. One of the things, just sorry, going back to answer to your question as well. One of the things that
yeah,
we really do is to create a database that allow us to have insights and understand how the data, being able to have
yeah,
reports and look at data. So really organize things just to make it efficient. And at the end of the day, when you have the reports, it really makes sense.
yeah,
So we use those metrics to understand, but those are direct metrics that are given by the platform. Indirect metrics are kind of harder, and
yeah,
we need to go and understand and have more impact, and understand where the impact can be indirect, right? Because maybe someone who actually searched for a product in episode, then they went there. So it's very
yeah,
hard to measure.
yeah,
But one of the things that we wanted is to have 1 million users over time that that somehow in some way have used one of our products and that are kind of registered with us. So it's a long way.
One another question that I have for you regarding to the first one is about the data. As you speak, I think it's crucial information for both sides, and the same information can be used also, of course, by the pharmacy and the other clients to organize their supply chain or to prevent to be out of stock. It's like a kind of service that Appy Pay sell to them, or just give them for free.
That's the whole service. Well, it depends on the levels, right? If you want a very tailored and the specific report, if you are a manufacturer or if you have a brand, then it's things that are charged and that we kind of place there. Pharmacies that work with us, we have the generic metric that we share and help them with their stock. Then we can have something more kind of reliable on, let me help you with your purchases, right? Let me tell you what people are actually really looking for and how this can be of value for you. One of the things that we have since the beginning is so we kind of base the whole privacy thing in a strict way. So, for example, we don't share people's contacts with pharmacies unless it's kind of needed. We share the last
Yeah.
three digit phone numbers, for example. So
Yeah.
they know it's 313, but they don't know it belongs to Manuel or Pedro, because we
Yeah.
only share that information if there's kind of a consent. So kind of the GDPR-ish privacy by design. Especially
Yeah.
because we are in the healthcare environment and we really want to make sure that this is respected. So when we are building reports for pharmacies, there's no way for them to, they understand the trend but they don't understand kind of the detail. But
Ah, okay.
that allows them to really, and the trend is what they
The
need.
forecast. Yeah.
Yeah, the trend is what they need to understand. Maybe I should kind of be buying this product instead of investing on that one.
Yeah.
And it's, having things digitized is really what empowers your business, and that's how we are working with pharmacies, and I think the whole healthcare
Yeah.
system.
Great. And Pedro, how do you see the role of technology evolving in address social issues in Angola and similar regions?
Well, the thing about tech is that the whole idea is that it becomes more democratic in a way. So if I can have access to a phone, if it's kind of cheap internet, if it's a cheap phone, which is something that we discuss a lot, and I can have the content for free, then I have more power to make my own decisions and understand better, right? So we really believe that using technology in a proper way and with some strategy as well can really address some of the issues that we have. Well, doesn't solve agriculture today, but maybe helps organizing the how we distribute foods in different places, because if information is digitized and if we can have the services running on top, then of course we can make better decisions. And when we are talking about 5-10 years ago, we are talking about data and big data and how data is important, but people were trying to understand how can this really have an impact, right? Now we are talking about AI and machine learning, and we're like, so if you have the systems that are intelligent running on top of reliable data, then really you can start having better decisions based on patterns. Um, so technology is evolving in that way, and the more data and the more things we have can really help us create something better. However, we need to be able to master the tools and understand what's behind it. So that's a little bit of our job, right? It's also when we are discussing about an implementation and thinking with partners, we are trying to make it simple instead of complicating things, to create an impact.
Yeah, great, great. And we have seen the impact that episode has been creating in the markets, especially based on information that you are sharing with us. And we have seen, it's funny because yesterday I heard a podcast and someone says that Rockefeller said once that their business was not drilling oil, but was to taking decisions. So they should to create an internal environment based on information and people and conversations that supports them to take decisions. So it's very important when you develop a platform that supports people, especially in the traditional trade and so on, in different segments of the market, to support them to be in this position of to take the better decisions based on the business that they are running, and it's a huge for the continent.
Yeah.
And based on that, and you spoke previously regarding to Kassai projects. In your opinion, what has been the impact of the Kassai project in the healthcare ecosystem? Understanding the impact that it has been for you guys.
No, amazing. I really love this platform and product because just drives, it goes directly to a pain point, right? Which is improving capacity and kind of empowering healthcare workers in a way that they can. Malaria courses, the courses are mostly about malaria. We had COVID-19 because the platform was launched in 2020. Can you imagine,
Yeah,
during COVID, no one had training, new procedures, etc. So it was kind of easy or fast to create a course, place it online, and people were actually doing it. The impact is seen directly. So it seems on capacity. So pre and post test, as I mentioned. So we see the post test and we see the capacity improvement. We have connected that to information on with BSI on the national malaria or the national healthcare system, and we check the malaria information, right? So has malaria gone up? Okay, yes, it has. Do they have stock? Yes, they have stock. How is the knowledge of malaria in that specific hospital? Oh, it's not so high. Then okay, let's give a training. So the fact of having the platform kind of interconnected with other systems, national systems, you just really start making decisions on top of
Yeah.
real information, and that is amazing. Then you can actually start thinking of, instead of reacting, can I be preventive? Can I look at the future and understand that there's a pattern, and knowing that in
Yeah.
a certain place maybe I'll have a malaria spike in 2 or 3 months because I can see the trends and I understand the patterns. So that's kind of a next
Yeah.
level thing. But this is
Great.
the type
It's
of
great. Yeah.
impact that we are trying to look and say, can we organize things in a way that we are able to make interventions in the real world and organize this
Yeah.
and look at how this can impact KPIs. Of course, malaria uh, mortality rate is not only impacted by knowledge. However, there are different patterns and there are different weights that can be measured. So, answering to your question, we are seeing real and direct impact of Kassai.
Yeah.
Looking a lot at malaria, but also family planning. So malaria is kind of an issue, right? Nationally, and I think all over the world. However, we also have another kind of challenge, which is the family planning and the population growth. We talk about it a
Yeah.
lot. The population is growing faster than the economy, so this, so we see where this goes. So family
Yeah.
planning and being able to kind of control or pass information that is required will be one of the key things that will happen in the next few years, by the government, by
Yeah.
NGOs, by everyone. So that's also one of the things that we are passing to healthcare workers, so they can learn and understand the methods and be able to inform people better. And we are at the heart
Yeah.
of that, right? So we are kind of empowering with the tools and creating the content, and trying to create that impact in the public sector.
Yeah. And how do you see the adaptation of the more online health education for Angola and the continent, for example?
Yeah, interesting question. I think it's kind of a stare, right? So I will not tell you that we should jump directly to the digital. I'm speaking against myself. It's crazy, right? Say,
Yeah.
no, everyone will be digital. Everyone has smartphones. Everyone can do
Yeah.
things on their own. From what we see in the field implementation, it's not true. So, but we have a step, an in between step, which is
Yeah.
we are doing what is kind of called blended courses, which they have a teacher, they have the online, they have the tablets or whatever, they have whatever they need, and they can have the course, but the teacher is there as well. So what happens is that they
Yeah.
can do it at their own pace, right? But they
Mhm.
actually do it more, or they, at this point, they like to do more with the teacher because they can ask questions, etc. On the kind of teacher end, the course is already there, so it's not preparing a course and it's not random. So they are kind of following the logic and they are analyzing the different case scenarios, right? So the kind of the whole classroom just becomes more interesting because then you have the digital providing supports and the data, and you have the teacher kind of answering to questions and focusing on specific case scenarios. And I think this is a great way to move forward, where people can actually, the
Yeah.
ones who want to learn can learn directly digitally. The other ones can, we can use technology and do a blended learning instead of just paper based and I'll write somewhere. So I think the digital has steps until we are kind of fully digital, but that's okay, right? So we still have the
Yeah.
data online, people can have access to that, and the teacher can have a support that gives him enough confidence to, it's sure is saying the right thing. That's also important. So
Yeah.
yeah, I see the digital as a path, and I think we are not fully digital yet, but if things go well, we will be.
Yeah, it's. I think it's a process. What we see, what we have seen in this market is a process. It's more about where the digital can help to close some gaps,
Mm.
and we have seen in your business is exactly what you are doing in certain levels, and also in in the payment sectors, working as a facilitator. I think Appy Pay was the first one to facilitate
More or less.
the digital payment process in Angola. And considering that the country needs these payment methods, how do you see the evolution of the models considering the growing of the competition?
Well, just a quick story about Appy Pay. It was born because in Appy Saúde we needed a payment system, so we had to develop and implement that. So we went to Image and said we want to implement. They said, implement. Just took us a long time. We were like, okay, is everyone
Yeah,
going to do this type of investment to integrate? Doesn't didn't make any. Well, we understood that not all companies would do that, so we kind of saw an opportunity for a payment gateway in our market. So we
yeah,
started developing from there. So answering to your question, I think yes, there will be competition and it will grow, but that's part of the business, right? If you create value and if you make something that is useful, then
yeah,
yes. If not, no. But we are at the position that is interesting because we are a payment gateway. We are not a payment provider, so we are not
yeah,
competing with Unitel Money or Emise or PayPay. They are the ones who hold the final users, right? We are
yeah,
actually helping companies, merchants, to connect to those payment services, which,
yeah,
because there are many, they need to integrate with each one of them and manage that. So we are doing that and providing access to merchants, which is often something that people don't see. But it's very, very
yeah,
useful because if you have a large network of people, of merchants, then you have a lot of services running on your payments processes, etc. So that's the work that we are doing. There's some competition. I think it will grow, and we'll have some international competition, which is kind of harder. But that's yeah. If it keeps us awake at night, let's
part of
go.
the process.
Yeah,
Yeah,
that's life.
yeah. Pedro, I will pass to Victor again. They have some other questions for you. Thank you, Pedro.
Thank you, Manuel. Well, it's so interesting, this entrepreneurial journey. This is interesting for someone who wants to embark in an entrepreneurial journey. This kind of challenges. What would could you share to aspiring entrepreneurs in terms of your experience? Because you left eventually a promising career in a corporate to do this entrepreneurial journey. So, what kind of advice could you give to aspiring entrepreneurs?
Well, different people have different purposes, right? So, which I understand. So, what I can tell you what I see from my path and our path. We are kind of a group building this together. So, as you mentioned, we are focused on the long run and kind of creating impact, and we understand the long run is long. So taking the steps one by one and going. I think one of the things is that our purpose is very clear in our minds, and I think it's important for new entrepreneurs to understand that there's one thing that the nice stories of that we see from the USA and saying, no, I was at the back of the garage and then something happened and I created an amazing product and the market bought that product the next day. Oh my God, this is great. Now I'm number 3 in the world. Okay. So probably it won't go like that. Go ahead.
But Pedro, let me just also tell you that that story is very interesting, and that I don't know if it's a lie, but it's kind of a lie, because, for instance, Amazon didn't have any profit for 13 years, I think. Facebook, the first 5 to 6 years, they had no income source. So everyone was investing on it. Everyone was putting money, and cash was pouring from all over the place. And you need VCs that have an appetite for the market, and where you're from, you don't have that VC structure to help you. And so that's also a question. And I'm sorry, Victor, but I have to put this. But you told us that you did a partnership very early in your early stage of the company. How was that partnership in terms of decision? Did you like, okay, I want to take this on my own, or did you accept it easily? This kind of, okay, I have to be with this big company because Sistec is a big tech company in Angola. How did you manage that?
Easily. So basically saying and understanding from the beginning that great things are built together, and then just trying to understand if Sistec is a big company. We kind of explained the project, explained the purpose in what we were doing, and they showed kind of openness in doing that. So it was plus having people on board as well, key stakeholders and people who are actually building the company with us. So the whole idea is let's build this together instead of building a one-man show or two-man show. So I think that's one of the critical things, to be able to have the right people and the right companies and partners around you. As long as you know what you are building, and you kind of understand that, I think that's one key success factor. And as you mentioned, Andre, this is not the USA, so there are no VCs just running around the streets. Sorry if I hope I'm not breaking any hearts here, but
No,
there are
you're not.
no.
You're not.
Uh, so, so it's not the same story, and the market is not as mature as the market in Europe or the USA. So even payment methods are growing now. They have credit cards and things coming from years ago. So it's completely different, in a completely different scenario, where we need to build things in a different way, actually. So yeah, having those companies on board, great. Then we need to be able to kind of create value and grow from there. So yeah. So my advice would be, defining the right purpose, building the right team. So I think it's super important to not to think we can do everything all by ourselves. Then if we really believe, I see some entrepreneurs actually working on companies and having part-time jobs. I understand for security. I just think that even if you're doing full-time is hard, part-time you really, you really need to be very, very good or be very, very lucky. I don't know, but it's hard to do it as a full-time job with the right team. It's even harder, of course, if you're not kind of fully committed. So make the step and go ahead. And I think one of the things that we have here is also kind of a lot of critical thinking. I'm challenged every day by everyone who has critical thinking, and hopefully everyone around me, which will kind of drive us while we are making decisions to make the right ones. So I really think we are not looking to work with yes man people. So we are really trying to build something, and the result is what defines how we move forward. So again, this is part of what I have said, building a good team. So that's part of that, right? And that's a major challenge in our context. um, I think also being able to find investors and people who can actually take the risk, because from one time to another we need that. So when we are talking about them, pharma and other companies, they have millions, but millions in terms of investment. So to be able to dream of competing with companies like that, you need to be able to have a structure that can understand how investment works, and how this can actually grow with other type of partners, which is what we are kind of aspiring and looking at in the future.
Yeah, I guess as you mentioned, it's very important to build the right team. How is your process? How do you pinpoint the right talents? Because I guess you cannot do say lots of hiring and selecting and so on. How do you approach this?
Well, we sell the dream and the story. When we are competing with oil companies, you, you have the purpose. But it's real because, again, one of the things is that, as I mentioned, I knew people in the tech environment, from mobile operators, etc. So that kind of allowed me to have an insight of people who could actually help, tech people who could actually help building. Then around me, for example, there's kind of Daniel, who was pretty much Daniel Cohen, who was pretty much involved in the beginning. Great guy, worked in KPMG, Sumitomo, etc., with a lot of business oriented, very open, and with the same drive. That is kind of a critical success factor for us in having the right team at the beginning. Then what we do is we really try to understand critical thinking of different people. Of course, it's harder in our context, because sometimes and often we are kind of competing with larger companies that have more budget and that hire the resources. However, we try to be as competitive as possible based on our dimension, but being able to analyze or talking to someone, understanding the critical thinking, and having the knowledge and kind of presenting the purpose is one of the things that we try. But I will not lie,
Yeah,
Victor, this is very hard because this takes us a lot of time to build the right people. But we have
yeah,
people that has been working with us almost since the
yeah.
beginning, and they are very good. So we are kind of lucky in the way that we are building that as well and finding the right people, and passing the word.
Yeah, and the fact that you have, let's say, a
Mm.
long-term purpose, a long-term motivation, also engage people around that
Yeah,
purpose. Yeah, rather than other, let's say, financial motivations or short-term motivations.
yeah,
Yeah. So probably that has been
that's a key
a
factor
key
as well. You're
factor,
right.
right? Thank you, Pedro. I'm handing over to
Thank you,
Thank
Andre.
you.
Victor.
Thank you, Victor.
So we're coming to the end, and we walked a long path, knowing a lot about, or knowing more about Happy People and how you developed your company, how you developed your solutions, and you talked about collecting information, which is mandatory and fundamental for the development of the country and of Africa in general. Well, it's probably one of our biggest complaints and biggest needs. You also talked about detecting patterns as the next step that you want to achieve. So you want to go a next step and even understand where some kind of casualties or some kind of malaria epidemic can surge or any other epidemic can surge, and you want to understand that and even prevent or prepare better. So now we have to understand something, which is future plans for Appy People. How does it work? Are you going AI on this? What is your plan for the future in terms of the company? And what do you think that are the main challenges? Because one of the things, and then let me just explain this, because one of the things that I was listening to you and I was thinking, this makes a lot of sense to use this same approach to other markets, and I'm not saying to other countries, I'm saying to other markets that are also very fertile and in need of this kind of solutions. How do you see this evolving, and what are your plans of expansion?
Yeah, that's one of the things that we discuss all the time. So in terms of plan and in terms of what drives us, I think I mentioned we want to reach the 1 million people, right? So we again create the impact at a wider scale. That's why we are working in kind of the public sector as well, and being able to go to public hospitals, implement it at the national, more national scale, not only the private. Working with insurance companies, I'm talking about the healthcare, working with insurance companies as well. Their penetration is not the highest, but still it's kind of higher, and it will grow. I think it will grow, of course. We see ANSA bringing the insurances for lower insurance for healthcare. So definitely there's a path to go. We also see that Angola is placing more attention to the whole region, discussing more about, for example, in payments, inter-regional payments, discussing more. We hear about more, different countries or Congo, etc. So we had an experience in Rwanda, which was interesting. So we think of expansion in a way, but we really want to have it in markets that are similar to what we have in terms of, as you mentioned, Andrea, it's not the whole market, but segments that make sense. And what we see in sub-Saharan Africa mostly is that there are some similarities. That one of the reasons that we also kind of built the whole platform in English as well. So there's the way that we build is already thinking on being international. Of course, it's not only the language, but just to give you the idea. So future for Appy People is really public sector, definitely, in terms of solutions with the right partners to create impact. And of course, thinking of expansion in mostly different countries nearby, very hard based on where we are. Different segments is something that we are open and discussing, but it's not completely defined in our roadmap, to be transparent. So that's something that we can address, but not directed to what we are building directly now.
So just to sum up a little bit of what you were saying that so public sector. You're going to keep in the public sector. You work with them. Also, you're going to enter in the insurance market, or like micro insurance market mostly, which is something that is surging also in the Angolan market. You have, I think, ENSA, but also most of the other companies, they're launching this kind of product. Yeah. And you want to go there. It's interesting. We had this talk with Neto, Ipeme Neto. I don't know if you've seen the episode. And he's already launching his own insurance or micro insurance for $1 to protect people from malaria, for instance. And it's very interesting what they're doing in Nigeria. Who knows what can come from that partnership.
Yeah, sorry, Andrea, just because one of the things is we don't want to reinvent the wheel. So basically, we prefer to have a partner that can kind of support, and we build this together. We have the network, we have that experience with the pharmacies, with the healthcare providers. We can have a partner in the insurance realm, or the microinsurance realm, that can kind of handle that. And we can find a way of helping people to buy products that they often cannot buy. And that is one critical issue that we have here. So access to information, yes, but people also need money to buy the products, right? So that's the other level that we would like to help and address.
Okay, so you don't want to go and do everything. You're more like a marketplace, and you want to leave what's to do from the insurance companies to them, correct?
Yes, we are looking at, again, partnerships that can actually make sense for us, not building everything on our own, but as you mentioned in the beginning, connecting the dots to create an impact.
Well, it's a strategy, and it's your way of building, and it's probably focusing on what you're good at and what you've been practicing mostly. That probably is going to be your biggest way out, right? Who knows? Hope that it's a good strategy for you guys, and we are here cheering for you. We're cheering. Come on. It's very hard to be an entrepreneur in Africa. It's very hard to be an entrepreneur in Angola. And being an entrepreneur in the tech world, it brings hardship to you, and it hardens you. So look, for us and from our team, I think that you have all the support, and count with us. Pedro, thank you so much for coming to our show. Thank you so much for sharing your story, for sharing your insights on how to assemble a company, how to put the insurance and the data and the clients and the pharmacies and the clinics, everyone in the same platform. So this is major game changer from all I see in the market. So thank you so much. To our listeners, thank you so much for following, for listening to us. I hope you can comment and share with you what you think about Pedro's app, and put a like on our video. Thank you so much. See you next week.
Thank you.
Thank you, Andrea. Thank you, Vitor.